Do me a favor before you do anything else. Swallow, just once. Really pay attention to it. Feel that? That thick little pull at the back of your throat that never quite clears, no matter how many times you cough into your fist or knock back a glass of water. That's not your imagination. And it's not just getting older. That feeling has a cause. Actually, it almost always has more than one cause. And by the end of this video, you're going to know exactly which ones are happening in your body right now, because I'm about to walk you through how to tell. Here's what gets me about this topic. Most people who deal with this have been dealing with it for years. Not weeks, years. It didn't show up overnight. It crept in. Maybe it started as a little throat clearing in the morning, the kind you barely noticed. Then IT started showing up after meals. Then it just never really left. You started carrying water with you everywhere. You started avoiding certain foods because you knew they'd set it off. You've probably tried honey, lemon, ginger tea, those menthol lozenges that taste like a chemistry experiment. And none of it actually touched the real problem because none of it was aimed at the real problem. That's the thing I want you to sit with for a second. Your body doesn't produce excess mucus for no reason. It's not random, and it's not simply wear and tear. Mucus is a signal. It's your body trying to tell you something specific. And today, we're going to translate that signal together. I've spent a long time working in senior wellness, and if there's one symptom I've watched get consistently misunderstood, it's this one. People get handed a bag of lozenges and told to drink more fluids, and then they're sent on their way, while the actual cause keeps quietly doing its thing underneath the surface. So today, we're doing this differently. I'm going to walk you through 5 well-documented causes of persistent throat mucus in adults over 55. But more than that, I'm going to show you how 2 or 3 of these tend to gang up on each other, which is exactly why the problem feels so much bigger and more stubborn than it should. Quick disclaimer before we start, because I take this seriously, I'm not your doctor, and nothing here replaces an actual medical evaluation. What I am is someone who has spent years helping people your age make sense of symptoms like this one, and I want to arm you with the right questions to bring to your next appointment. Because the truth is, most of the causes we're about to cover take about 30 seconds for a doctor to check for, once you know to ask. One more thing before we dive in. Down in the comments, tell me this. Is your throat worse first thing in the morning, or does it bother you all day long? Don't skip that. Your answer actually narrows down which of these 5 causes is most likely driving your particular case, and I'll explain why as we go. All right, let's get into the biology, because there's a piece of this that almost nobody explains properly. And once you understand it, this entire topic starts to make sense. Your body was never supposed to stop making mucus. Here's something that might surprise you. Your body is making mucus right now, constantly. Every hour of every day, whether you're awake, asleep, sick, or perfectly healthy. And that's not a malfunction. That's the system working exactly as designed. Mucus is your airway's built-in armor. It's a thin, moist coating that traps dust, bacteria, and viruses before they ever get the chance to travel deeper into your lungs. It keeps the delicate tissue of your throat from drying out and cracking. Without it, your airway would be defenseless. So the goal was never zero mucus. The goal is mucus that's thin, that moves, and that clears out before you ever notice it's there. That clearing part is where things start to shift as we age, and this is the piece most people have never been told. Lining your airway are millions of microscopic hair-like structures called cilia. Their entire job is to sweep mucus up and out constantly like a conveyor belt you never see working. In a younger adult, that conveyor belt runs fast and efficient. Mucus gets produced and cleared almost as fast as it's made. But research on aging airways has shown fairly consistently that ciliary movement slows down over time. The sweep gets a little weaker, a little less frequent. What that means in practical terms is this. Mucus that would have been cleared in seconds at 35 can sit and thicken for hours at 65 or 70. And so it's not necessarily that your body is producing dramatically more mucus than it used to. It's that whatever mucus does get produced now has a much harder time leaving. That single shift in physiology is the reason everything else on this list hits so much harder after 55 than it would have at 30. It's the multiplier sitting underneath all 5 causes we're about to go through. So keep that idea in your back pocket because we're going to come back to it. Let's start with the cause that, in my experience, gets missed more than any other on this list. Because 1, the reflux, you never feel coming. When most people hear acid reflux, they picture heartburn on that burning sensation behind the breastbone after a big meal. Classic, obvious, easy to connect to the stomach. But there's a quieter cousin of that condition, and it's sneaky precisely because it doesn't look like reflux at all. No burning, no chest discomfort, nothing that points you toward your stomach, just a throat that refuses to settle down day after day. Here's the mechanism. At the point where your esophagus meets your stomach, There's a muscular valve whose entire job is to stay shut once food goes down, keeping stomach acid exactly where it belongs. As we get older, that valve can lose some of its tone. Think of a rubber band that's been stretched one too many times and doesn't snap back the way it used to. And when it doesn't seal completely, acid can travel upward, not just into the esophagus, but all the way past it, into the throat, the voice box, sometimes even up toward the nasal passages. And here's the part that makes this version of reflux so much more disruptive than ordinary heartburn. Your throat tissue was never built to handle acid the way your esophagus is. The esophagus has some natural resistance. The throat has almost none. So even a small, brief amount of acid reaching that tissue triggers an immediate defensive response. Your body floods the area with thick, protective mucus to shield it. That's smart biology. But if it's happening quietly, night after night while you sleep, you wake up every single morning to that same heavy, coated feeling with absolutely no idea why. Because there was no burning to tip you off. Clinicians who specialize in this area have observed that a large share of people dealing with this silent form of reflux report no heartburn whatsoever, just chronic throat clearing, a voice that sounds rough or hoarse first thing in the morning, and mucus that seems to be waiting for them the second they wake up. So ask yourself honestly, is your throat noticeably worse in the morning than later in the day? Does it act up when you bend forward or lie flat? Does your voice sound different for the first hour after waking? Those are the fingerprints of this quiet form of reflux. And when we get to the practical steps near the end of this video, I'll give you specific things you can try tonight. One more note worth flagging here. If you regularly take anti-inflammatory pain relievers, ibuprofen, naproxen, the common ones people reach for with joint pain, those medications are known to reduce the stomach lining's natural protection. That can make any form of acid reflux, including the silent version, more likely or more severe. If that describes you and your throat has been bothering you consistently, that connection is worth raising with your doctor directly. All right, go ahead and drop your name and where you're watching from in the conv. NTS. I read through them, and I want to know who's actually here with me today. Now let's move to cause number 2, because this one hides in plain sight. Cause 2, the drip you can't see or feel. When people picture a sinus problem, they picture the dramatic version, pounding. Facial pressure, a nose completely blocked, the kind of sinus infection that stops you in your tracks. But in a lot of adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels basically fine. There's no real headache, and yet the sinuses, just mildly swollen, just slightly overproducing, are quietly draining down the back of the throat all day long, every day, without you ever consciously feeling congested. Here's why this connection gets missed so often. The side effect can take weeks, sometimes months, to show up after starting the medication. So if you started a new blood pressure prescription 8 months ago, and your throat symptoms crept in around month 6, your brain never files those two events. Together, they feel completely unrelated. But that delayed timing is exactly the pattern clinicians associate with this side effect. And research has generally found that older adults experience this particular throat reaction more often than younger patients on the same medication class. If you're on a blood pressure medication and you're not sure whether it falls into this category, your pharmacist can tell you in under a minute, no appointment needed. And if it turns out it does, there are alternative medication classes, ARBs, angiotensin receptor blockers, that manage blood pressure just as effectively without carrying this specific side effect. That's a conversation worth having with whoever prescribed it, not something to change on your own. If you're still with me, type the word clarity down in the comments, because that's really the whole point of this video. Giving you clarity on something that's probably been frustrating you for a long time. Cause number 4 is one people tend to wave off as too obvious to matter. I promise you it isn't. Cause 4, the hydration problem. You don't feel coming. Let me give you the actual physiology here, because this is more nuanced than just drink more water. Mucus is mostly water. Its texture, and whether it flows thin and easy or sits thick and stubborn, depends heavily on how well hydrated the surrounding tissue is. Picture maple syrup straight out of a fresh bottle, compared to maple syrup that's been left open on the counter overnight. Same substance, completely different behavior, based purely on how much moisture it's retained. Your mucus behaves the exact same way. Here's the twist that makes this more than a generic reminder to drink water. Your thirst mechanism itself becomes less reliable with age. A younger adult typically feels thirsty well before they're meaningfully dehydrated. It's an early warning system that works. In older adults, that warning system tends to dull, which means you can be dehydrated enough to noticeably thicken your mucus and affect your comfort throughout the day without ever actually feeling thirsty. If you're waiting for thirst to remind you to drink, you're consistently playing catch-up. And a body that's mildly, chronically underhydrated day after day keeps mucus persistently thick and sticky in a way that amplifies everything else on this list. The reflux, the sinus drainage, all of it gets worse when the underlying tissue is dry. A commonly cited hydration target in clinical nutrition guidance is roughly 30 milliliters per kilogram of body weight per day from all sources. That includes water, herbal tea, soup, and water-rich foods, not just what comes out of a glass, but the real key isn't the exact. This is called postnasal drip, and it turns out this age range is disproportionately affected by it. Not a coincidence, but a direct result of how nasal tissue and mucus production shift over the decades. Here's where a lot of people go wrong trying to fix it on their own. They assume it's seasonal allergies, so they reach for the counter antihistamine. And for a while it seems to help, because antihistamines dry things out. But drying isn't the same as healing. Antihistamines do nothing for the underlying inflammation actually causing the excess production in the first place. Worse, dried and thickened mucus stuck at the back of your throat can feel even more uncomfortable than the original wetness did. The approach with the most consistent support behind it is refreshingly simple and cheap. Regular nasal rinsing with a warm saline solution. Reviews of the research across sinus and nasal conditions have repeatedly pointed to saline irrigation as a safe, low-cost, genuinely effective strategy. And it's widely used as a supportive treatment by ENT specialists around the world. The way it works is mechanical rather than chemical. High-volume saline rinses physically flush out inflammatory mucus, calm the swelling in the mucosal lining, and, this part matters, actually help restore that ciliary sweeping function we talked about earlier, the exact system that slows down as we age. The single word that determines whether this actually works for you is consistency. Doing tea once or twice buys you a day or two of relief, and then you're back where you started. Doing it daily, correctly, is what produces a real, lasting shift. I'll walk you through the exact method later in this video. If this is landing for you, type number 2 in the comments so I know you're still with me. And if you haven't yet, go ahead and subscribe. It genuinely helps this reach more people who need it. Now, because number 3 is the one that tends to catch people completely off guard, because it's hiding somewhere they'd never think to look. Their own medicine cabinet. Because 3, the pill you've been taking for years. When I sit down with someone and we start working through what might be driving their throat symptoms, their daily medications are almost never on their radar, especially the ones they've been taking faithfully for months or years without a second thought. There's a widely prescribed category of blood pressure medication called ACE inhibitors, angiotensin-converting enzyme inhibitors if you want the full name. These drugs are effective, generally well tolerated, and they do genuinely important work protecting the heart and kidneys. But they carry a well-documented class-wide side effect. They allow a compound called bradykinin to build up in the body and in a meaningful subset of people. That buildup leads to persistent throat irritation and a nagging, near-constant urge to clear the throat. I want to be clear about something important here. This isn't an allergic reaction, and it isn't a sign that something's wrong with you. It's simply how the medication interacts with your body chemistry, and some people's throats are more sensitive to that effect than others. Now, here's the part I promised you at the very start. The part most videos on this topic skip entirely. These 5 causes rarely act alone. In my experience, the 2 that show up together most often are silent reflux and age-related decline in ciliary clearance. Here's why that pairing is so brutal. The reflux keeps triggering fresh mucus production, night after night, while the slowed ciliary sweep means that mucus has nowhere fast to go. It just sits there, thickening, compounding, morning after morning. That combination alone explains why so many people feel like nothing they try ever really works, because they're only addressing half the equation. If postnasal drip is layered on top of that pairing, you end up with mucus arriving from 2 directions at once, both moving slower than they should. That's the perfect storm version of this problem, and it's more common in this age group than most people realize. So what do you actually do with all this? Start by paying attention to timing. If your symptoms are dramatically worse in the morning, reflux is very likely playing a role, and simple changes, not eating within 3 hours of bedtime, elevating the head of your bed a few inches, cutting back on caffeine and alcohol in the evening, can make a real difference within days, not months. If your symptoms are steady all day regardless of when you eat, sinus drainage is more likely the dominant factor, and a daily saline rinse done consistently for at least 2 to 3 weeks is genuinely worth trying before anything else. If you're on blood pressure medication, have that quick conversation with your pharmacist this week. It costs you nothing and could rule out or confirm a factor in minutes. Build hydration into your day deliberately rather than reactively. And if you've addressed all of that and the mucus is still hanging around, it's worth having a broader conversation with your doctor about gut health and inflammation. None of this replaces an actual medical evaluation. especially if your symptoms come with unexplained weight loss, difficult while swallowing, blood in your mucus, or a voice change that doesn't improve, all of which deserve a doctor's attention promptly, not a home remedy. Those particular red flags are the one place where I'd tell you to stop reading lists like this one altogether and just book the appointment. But for the everyday, stubborn, it's just always their version of this problem that so many people over 55 live with quietly, these 5 causes, and especially the way they tend to combine, are usually exactly where the answer is hiding. And I think that's honestly the most useful thing I can leave you with today. This symptom you've been living with isn't a mystery, and it isn't just part of getting older. It has a cause, sometimes 2 or 3 working together, and every one of them on this list is something you can act on this week, not someday. You don't need a complicated overhaul of your entire routine. You need to know which lever to pull, and now you do. If this video helped connect some dots for you, let me know in the comments which of these 5 hit closest to home, and stick around, because next week I'm going deeper into the exact nightly and morning routine that helps calm silent reflux step by step. I'll see you in the next one.